Hello, good morning. In the previous video, we have discussed about how to study the skull, like norma verticalis, norma frontalis, norma lateralis, norma basalis. In this video, we will go through the norma verticalis in detail. Now we can see the norma verticalis, how exactly it looks like. And the first thing in the norma verticalis, we should say that shape of the norma verticalis. From this side, how exactly the skull look like. See, we can see round to oval in shape almost. This is the shape of the norma verticalis. And now can see what are the bones present in the norma verticalis. What are the bones we can see in the norma verticalis. This is the upper part of the frontal bone and two parietal bone each side, and in some books they have mentioned the upper part of the occipital bone also. You can see this is the upper part of the occipital bone. Total 3 bones: upper part of the frontal bone and two parietal bones and upper part of the occipital bone. Now we will go through the sutures. How exactly what are the sutures present in the norma verticalis? This is the coronal suture. It's passing anteriorly and downwards, or we can call it as it runs forwardly, downwards and forwards. This is the coronal suture, which is present between the frontal bone and two parietal bone. And now this is another suture. It's going backwards or posteriorly going. This is the sagittal suture, which is placed between two parietal bones. And here we can see this is the lambdoid suture, which is present between the two parietal bones and one occipital bone, which is going which is passes downwards and forwards. It is also going downwards and forwards. There are 3 sutures in norma verticalis. This is the coronal suture, sagittal suture and lambdoid suture. Now we will see what are the features present in the norma verticalis. We can see the meeting point between the coronal suture and the sagittal suture. It is called as a bregma. And when we go posteriorly, the meeting point between the sagittal suture and the lambdoid suture is called as a lambda. And in front of or above, just above the 2.5 to 4 centimeter above the lambda, there are 2 foramens that is called as the parietal foramens, which supplies emissary vein from the scalp to superior sagittal sinus. And the area between two parietal foramina, it is called as oblivion. In fetus skull, there are some membranous gap which helps in the growth of the brain. And in the norma verticalis, we can see the 2 membranous gap, which are the anterior frontalis and posterior frontalis. The bregma is the site for anterior frontanale, and it fuses at the month of 18 to 24 months of the age. And as we go posteriorly, we can see the lambda is the site for the posterior frontanale, which closes or fuses at the month of 2 to 3 months of the age. Thank you.